Waiting on one more colleague to show up. All right, welcome. Thank you so much for joining us here today. I am really proud to be standing here with my great colleague, Councilmember Phylicia Porter, as well as our colleagues, Councilmember Odette Ramos, Councilman James Torrance, Councilman Christopher Burnett, Councilman Ryan Dorsey, as well as some amazing organizations in our city. We are also joined by Portia Pinder from the Baltimore Abortion Fund, Alyssa Clan from Baltimore Doula Project, and Karen Nelson from Planned Parenthood. Thank you all for joining us today. I never thought I'd be raising a son and a daughter in an America where states ban books, states restrict access to the ballot box, and the Supreme Court of the United States is considering taking away basic reproductive rights. The leaked memo that pretends a future where Roe Vs Wade is repealed is a direct assault on our civil liberties, in particular, our right to privacy. While we cannot change the hearts and minds of Supreme Court justices, we will not allow them to take away voice and choice here in Baltimore. Today, Councilmember Porter and I are proud to introduce a resolution calling on Mayor Scott to work with us to create a fund to support reproductive health care in our city. We will contribute to community-based organizations like the Baltimore Abortion Fund, the Baltimore Doula Project, and many, many others. We will help them expand their capacity to provide access to abortion and other services. Baltimore will not back down in our commitment to reproductive rights. We will help people from across the United States come here and get the services that they need. In 2017, I introduced and my colleagues passed a welcoming resolution reaffirming Baltimore's status as a welcoming city. Today, we double down on that commitment. Let's be clear. While everyone will be hurt by this decision by the Supreme Court, the Georgetown prep crowd that Justice Brett Kavanaugh grew up with will be less harmed. People in his social circle will continue to have more resources to terminate an unwanted pregnancy. For a man like Kavanaugh, who has never faced consequences for his own conduct, who told the Senate in his confirmation hearing that Roe was settled law, to now have the power to strip rights from the most vulnerable people in our society is an indictment of our entire justice system. The people this decision will most harm are struggling to get by in systems that weren't built for them. They come from places where maternal mortality rates far exceed the national average. They come from coal country and the Bible Belt. They are black and brown. Black women are 3.5 times more likely to die from childbirth complications than white women. They are trans and non-binary Americans whose identities are already marginalized and often erased. The Supreme Court has found yet another way to punish the poor and reinforce the patriarchy. In states like Michigan, it may be considered a felony to get an abortion. Here in Baltimore, we will not be silent. We will work with our health department to expand our own capacity, and we will support great organizations that share our commitment to reproductive justice. Our resolution also calls on Governor Hogan to stop running for president and immediately release the $3.5 million that he owes us to train healthcare providers and health navigators. In this moment of national regression, as our basic rights are peeled away one by one, our city stands in solidarity with oppressed people from around the world. We are prepared to be a sanctuary. We will do that with the leadership of my amazing colleagues standing with me, as well as the ones who are not here but who have been supportive of this resolution. and the amazing organizations that stand behind us. Now more than ever, we need each other. Thank you so much for joining us. It is now my great pleasure to introduce my colleague from the 10th District, Councilmember Phylicia Porter.
Thank you. I am so grateful to this entire family of grassroots organizers that sought to prioritize health care and reproductive rights for all. I am deeply conscious of the reality of the victory that belongs to the generations of brave women and men who fought tirelessly for the radical idea that women should determine their own lives on their own pretenses. This is an opportunity for Baltimore City and those advocating in this space for health care for all, and to be a thought leader and catalyst through local policy, no matter race, sexual orientation, or immigration status. This recent Supreme Court decision divides states across our country, introduced numerous restrictions on reproductive health care for women, cutting some women off from the only health care that they know. In a city where our population is more than 50% women, we need to prioritize women beyond the specific issues that we are talking about here today. We need to keep working for ways to support families and women in other ways, like reducing the wage and wealth gap here within our city. We need to finally pay women guaranteed equal pay for the same type of work that is exhibited by men.
That's right.
As you can imagine, these issues are long-standing healthcare effects within our city that had the propensity to determine our economic climate for our city and our nation and our social fabric for generations to come. Let's be clear. For some women, this is about life and death. I look forward to the continued support from all of the organizations here today, and I encourage you all to search your conscience. Just because you can go to a primary care provider does not mean that everybody can go to a primary care provider. And organizations and rights such as these are indoctrinated for all and not a privilege for the few. Thank you.
Thank you so much, Councilmember Porter. We will now hear from Portia Pinder from the Baltimore Abortion Fund.
Hi. It's like that. Yeah, of course. Like Councilman Cohen said, my name is Portia Pinder. I'm one of the co-directors for the Baltimore Abortion Fund. BAF started as a grassroots volunteer-run organization in 2014, and at the time our goal was to help Baltimore residents pay for their abortions. 8 years later, we are a fully staffed nonprofit organization that utilizes a confidential helpline to connect individuals to financial and practical support. We work directly with clinics and other abortion funds to ensure that everyone living in or traveling to Maryland has access to abortion care. In addition to funding, we also offer rides to and from clinics, lodging, and any other logistical support needed, including travel coordination for those traveling in from other states. The majority of our callers are people in their second trimester with an average out-of-pocket cost of $3,500. The cost of an abortion can range anywhere from $400 to over $10,000, and this is before factoring the cost of travel, childcare, and taking off time from work with no pay. While it is devastating to face the possibility of losing Roe, Roe alone has never been enough for so many people in this country. Legal does not mean accessible. It is important to name that many people, especially people of color and those working hard to those working hard to make ends meet do not have the access even now, pre-Roe. Despite the legal right to an abortion, they cannot get the care that they need. This is why Councilman Cohen and Baltimore City's support and funding for reproductive justice in this moment of crisis is so important. Over the last 2 years, our call volume has increased by 40% year over year. Half of our callers are Maryland residents, despite the strong legal protections we have for abortion in this state. If Roe were to be weakened or overturned, abortion rights would likely be stripped in more than half of the U.S. states, which means Maryland would become a receiving state for those traveling here. While it's difficult to know for sure, we are expecting that our call volume will increase by 60 to 100% if Roe falls. Alongside our community of organizations committed to reproductive justice in this state and a network of abortion funds across the nation, we have built the infrastructure necessary to make real abortion access a reality in Maryland. All we need are the funds and support to make this possible. Not just support in this moment, but in the weeks and months to come. This is why the City Council resolution is so important to us. We know that the future is far from certain, and we feel ready to take it on with the strength of this community and the city behind us. We will continue to fight for a world where abortion is not only legal, it is accessible, affordable, and destigmatized. No matter what happens next, we will be here funding abortion, taking care of each other, and affirming the human right to control our bodies and our lives. Thank you.
Thank you so much, Portia, and thank you for the amazing work that you all do. Next, we'll hear from Alyssa from the Baltimore Doula Project.
Hi, everyone. My name is Dr. Alyssa Klon. I am the abortion program coordinator for the Baltimore Doula Project. Like BAF, we also started in 2014 as a grassroots volunteer-run organization. We are still currently a volunteer-run grassroots nonprofit organization continuing to do the hard work of supporting people in our city and beyond our city to be able to access whatever choice is right for them. Our programs at Baltimore Doula Project range from providing doula care for people who are pregnant, who are experiencing childbirth, who are in their postpartum period, as well as people who are incarcerated in and just around our city, as well as people who are accessing abortion care in our city. So our doulas go to the clinics, sit with people before, during, and after their abortion care, and provide a listening ear, a steady and calm presence in the midst of making a healthcare decision that has been so stigmatized and so fraught with politicization in this country. While we weren't surprised by what will become the Supreme Court's decision on Roe vs. Wade, we were shocked and devastated by the language used in the text of the leak, as well as to really recognize the impact this is going to have on already marginalized communities. We know that people who are marginalized based on race, who are marginalized based on income, who are marginalized based on gender identity, and so many other factors already lack access to safe, legal abortion care in this country, and this is going to become so much worse as more than half of states in our country make it illegal, or even, as Zeke said, a felony to receive abortion care. Not only will those folks who are most marginalized lack access, they may also become the most likely to be prosecuted, incarcerated for accessing abortion care, not to mention having miscarriages or pregnancy loss that then also becomes politicized. Because of this, it is so critical that our community here in Baltimore stands together and makes the decision to really put our money where our mouth is and do something critical about what is happening in our country. We already have folks from all over the Eastern Seaboard come to Baltimore to receive abortion care, and we know that that's going to increase once this decision is made final and so many states follow suit. So in order to keep that right enshrined and in order to ensure that people can access the care that they need, we need funding to be able to fund these grassroots organizations like ours and like BAF that do this incredible work of making sure people can access that care and sitting with them to ensure that they feel comfortable, that they feel safe, and that they feel supported in making what should be a valid right in our country. So we are so appreciative of our council members, and we really support them and support them in calling on the governor and other politicians in our state and our city to really do what's needed and to make sure that Baltimore continues to be a place where people can access abortion care. Thank you.
Thank you so much, Dr. Alyssa. And now from Planned Parenthood, folks who've been doing the work for a very long time, from Maryland Planned Parenthood, Karen Nelson.
Good afternoon, everyone. Thank you for having me here today. 49 years ago, the U.S. Supreme Court made a landmark decision in the case of Roe v. Wade. And that recognized the constitutional right to a woman to make her own personal, private medical decisions. And today we are here fighting that fight once more. The threat to abortion care in this country, it is not a drill, it is not hypothetical. It is happening right here, right now. If the Supreme Court makes the decision, and it looks very likely that we know what the decision looks like now, this is unprecedented and it is downright dangerous. We know harm will come from this decision because we're seeing it play out right now in states like Texas. And we are currently seeing, as you've already heard, patients from other states who are having trouble to access abortion care, including patients from Texas right here in Baltimore today, every day since SB 8 went into effect last fall. Women in Baltimore need us to protect abortion access. They need this city council to protect abortion access. And the women will also need this protection, the women that are forced to travel because of what's going on in their states. At Planned Parenthood, we want the women of Baltimore to know that we stand with them. You and only you should be making decisions about your personal medical choices. No politicians, no bans, no Supreme Court should be interfering with you, your life, or your future. So it's my honor to stand here with the entire council as they stand up with a clear message to our allies and to our antagonists alike. Thank you, Councilmembers Cohen and Porter, for affirming that the right to abortion is meaningless without access. They are doing the work to make sure that people will be able to access medical care here in the city. So thank you. This is not just symbols, this isn't just talk, this is real, practical support that will get patients health care. So thank you for that. This resolution centers abortion funds, which are so critical in fighting this fight, removing the financial and logistical barriers so people can get to their healthcare appointments, and once they're there, they have support systems in place. So the Baltimore Abortion Fund and the Baltimore Doula Project, I'm so proud to stand here in solidarity as your partner in reproductive health and reproductive justice. Thank you for doing the work that you do that will continue to provide access and prevent stigma around this healthcare service that is a human right. Planned Parenthood stands for care, and will continue to provide the health care here in this city and across the state as long as we possibly can. And I want to thank the council and thank the city of Baltimore for allowing us to do so.
Well, again, thank you to all of our colleagues for standing with us. Thank you to our amazing providers in this city. We are just blessed to have a wealth of organizations doing this work, and we know that regardless of what the Supreme Court does, Baltimore will continue to protect vulnerable people regardless of whether Roe is repealed, regardless of any further assault on women's and other people's reproductive health. We will stand as a bulwark. So I appreciate everyone coming out today and happy to take any questions. So we've been in really good conversation with Mayor Scott, as well as a private philanthropy foundation to talk about where we could most make impact and how to set up a fund that is really about supporting those who are on the front line, doing the work, grassroots. My colleague, when we talked about this originally, she was really strong on it's got to be for the grassroots organizations that have been here, that are doing the work. So we are working with the mayor's office, we're working with private philanthropy to figure out exactly which dollars would go to this. But we as a council want to stand strong in saying that this is our value and we need to support it, and not just in words, but in deeds and with our own funds.
And also, sir, not only just leveraging financial funds, we are talking about leveraging advocacy funds from larger organizations to help these smaller organizations. So, we have the Baltimore Abortion Fund here, we have the Doula Project here, but there are other organizations like the Bloom Collective that are doing the work every single day in the city of Baltimore that not only need capacity, but also political will and technical assistance to grow their organization into something that can help many, many, many more people.
It sounds like Baltimore may be a destination point for those who are not just coming from around the state but across the country. How are you just logistically planning on working to kind of set that up? And then just to piggyback off of that, it sounds like you've had conversations with the mayor about this resolution. Is this a resolution you think he will lend his support for?
Yes, so we have already confirmed his support for this particular resolution. With regards to the logistics, that's something that, as Councilmember Cohen discussed, is very important to me. When we are talking about the efficiency of philanthropic organizations in relation to the city, we need to make sure that we have processes in place that we can get those funds to the street and people that are working in the field as soon as possible. So, one, having unrestricted funds whereby they are able to not only deal with staffing and capacity issues such as community organizer, but also to develop programs. Many grant funds that are associated with particular funding opportunities are restricted in nature. And so when you're talking about an opportunity for funding and you have restrictions in place, organizations that do the work every single day are not able to fully lean into their maximum value. So this opportunity would allow them to do as they see fit with these funds so that they can properly operationalize their mission.
What is your message to the women who are from Baltimore City who are concerned if they do want an abortion and are hearing reports that it might take them longer to get one because there are so many people coming from other places?
So yes, that is a good question. And the message that I would give to them is really such as this. This is local organizing and local policy in action. When we talk about opportunities for Roe v. Wade, the repeal of Roe v. Wade, the response from your local government is exactly what we're doing here today. Having local advocacy, having community organizations, highlighting different organizations such as the Bloom Collective and the Baltimore Doula Project in order to get that messaging and advocacy across, to provide a partnership with them, because it's scary. To get involved into local advocacy is very scary. It's something that many people, they necessarily don't do. And so this is an opportunity. This is an opportunity for them to do it in real time and in action with a partner in local government with them.
And I would just add, Annie Rose, that Baltimore has done this before. We have always been a destination for folks seeking great medical care in our city. Who would have thought at the beginning of the COVID-19 pandemic that Baltimore would have emerged as a national leader in getting folks vaccinated and in preventing deaths? We know that we have some of the best medical institutions in the world. We have some of the best grassroots organizations like the ones standing with us today, and we have the political will to do it. When we were named by a report from Hopkins as one of the leading cities with a similar demographic pattern to ours in preventing death from COVID-19, I think that should have told you that Baltimore is a place where anything can happen when we put our minds to it, and that we are going to be a safe sanctuary for all who need to come here to get their reproductive health.
You mentioned that Governor Larry Hogan has been very firm about his decision not to release the $3.5 million for the clinician training program. Are you planning on taking any organized action to voice opposition to that?
Absolutely. Again, when we're talking about healthcare, while abortion rights, there are some in Maryland. When we're talking about $3.5 million that can be used for health navigators in order to organize and stay with women and men as they go to their reproductive appointments. This is an opportunity for Governor Hogan to stand up and to really have his budget match his moral priorities, in which he says that he cares about. And so I certainly plan to organize along with other community-based organizations so that we can get that $3.5 million to the people that really need it and the people that are working every single day, the people that are taking people to appointments, the people that are navigating healthcare access with regards to filling out forms for individuals. That's a real issue that we are seeing here in a city like Baltimore that has monumental public health institutions here. We are still challenged with healthcare access and healthcare navigation and healthcare delivery.
And are you prepared to offer up the infrastructure for a training facility for clinicians?
So, look, just to start with the question around Governor Hogan, this is a governor who likes to go on MSNBC and claim to be a moderate and say that he is the common sense adult in the room. Well, guess what? The vast majority of Americans support reproductive health care. So he is in the extreme position by not providing the funds that he is required by law to provide. The legislature passed it. Now he needs to simply fund it. And while we understand that he is running in a Republican primary that is increasingly right-wing, as the governor of Maryland, as a state that has stood for reproductive health care for years and years and years, we, in this resolution and in our own organizing, are calling on him to do the right thing and simply provide the money that he is required by law to provide. Sorry, what was the second question?
It's a clinician training program, so it would partner with local hospitals and healthcare facilities to train nurse practitioners
Right.
and doctors who haven't received abortion training.
Yes.
Are you able and willing to provide the space to do so beginning July 1st if he decides to release the funds?
So part of what this resolution calls on us internally to do is work with our health department to make sure we have all the logistics, all the, to your point, training facilities, whatever we need, that's what we want to be part of doing. I absolutely believe that our mayor, our health commissioner will support efforts to train clinicians here in Baltimore. As the council, we don't necessarily get to decide that, but that is certainly something that we are pushing for and want to just make sure that our health department and all of us are working toward the same goal.
Any other questions?
All right.
Thank you.
Thank you so much.
Thank you so much.
Appreciate y'all. Thanks for coming.
Thank you.
Good. Hi. Good to see you. Did you get my text message?
No.
It's okay. I just wanted to give you a heads up. We wanted to see if we could talk to you about the letters sent to Miss
Yeah. Sure.
Saturday. Is that okay?
Sure.
Maybe